Everybody's affected by obesity. And not only do adults have a serious epidemic, but so do children. In the United States, we have probably 15 to 30 million people who could potentially qualify for surgery now. That's it's almost 10% of the population. It starts off with diet and exercise, behavioral change, which is where it should always start. The safest, the least invasive things first. For those patients who don't do well with that, you can consider medications, and the medications are getting better and better. And for patients who don't tolerate medication, don't want to take it lifetime, or would otherwise qualify for surgery based on their weight, then we can start to consider surgical options. And right now, the majority of these surgical options are done laparoscopically by surgeons such as myself. The two major operations performed throughout the world are the gastric bypass and the sleeve gastrectomy. And currently, the sleeve gastrectomy is a bit more popular than the bypass because it's a little safer and simpler. How to decide what operation is best for a particular patient is not easy to answer. It's my philosophy that it has to be a group decision between me, the patient, and possibly their family, because they live with that operation. So I think it's important to be able to explain to the patient the benefits, the characteristics of each operation, and help guide them to pick the one that they're going to be comfortable with. At Brigham and Women's Hospital, we have an integrated program that includes not only surgeons, dietitians, psychologists, physician assistants, plus you could expand that to include the nurses, both in the operating room and the floor, the anesthesiologists, the consultants, and everybody else involved with the patients. The feedback I get from patients in the short run, shortly after surgery, was how well they were cared for at the hospital by everybody involved, the residents, the fellow, the nurses, the doctors, etc. On the longer run, people who come back to clinic that have been out from surgery, could be several months to many years. I hear how great their life is now, how happy they are, what a great decision they made having surgery. They can run around with their grandkids again. They couldn't before. They can wear a bathing suit and not be embarrassed. They're not taking shots of insulin every day anymore. That their life is so much different and so much better. And I've heard from a number of people over the years say, this was my new birthday.